20-somethings. Georgia and Emma team up to create a podcast. In Have You Tried Yoga?
Hello, welcome back.
Welcome back to episode 8 of
Have You Tried Yoga?
This episode is called The V Word, and let's just get out of the way and say what the V Word is. Ready? 1, 2, 3.
Vaginismus.
Velcro.
Oh, okay.
No, it's not Velcro.
Velcro is a feat of modern science. I'll have you know.
Velcro is a very, very controversial
The
item
fact that
and
it
issue.
keeps re-sticking scares me. I want to know why the little pointy curved tips don't go straight. Shut up. It's something I think about when I can't sleep. Why does Velcro work for so long?
That's actually what your thesis is about, isn't it?
Yeah.
It's about Velcro.
I actually might bring up my thesis a little bit later on.
But yeah, I'm Emma,
And I'm Georgia.
and yeah.
You will know us from this podcast. And that's about it.
Yeah.
We're just two girls on a podcast who happen to have pain. And really stoked to be here.
Yeah, super stoked.
It
We
is.
are though. We sound very sarcastic.
We are. It's a Friday here in busy Vegas, and it's been storming on and off. So,
But then it's really hot today.
it is a balmy hot day. Yes.
Oh,
Although
Struth.
although Georgia, myself, am very happy about that because the stormy storms have been giving her the achy ache. Because my joints are
Oh,
like,
now we know.
the joints are like, what is this pressure and moisture?
And really, really hurting.
Yeah, like Emma can vouch that I just messaged her and was like, it needs to stop storming. There's only so many naps one can take.
Oh.
But I'm good now.
But I'm sure a lot of people can relate. How you been, Georgia?
I'm good. I have been working on not the podcast. Emma has been doing a lot of the research today because Emma is awesome and she's got some lived experience.
Yes.
Okay.
That is the reason we are doing this podcast.
Yes.
Because it is my lived experience.
Okay, cool. Rad. We're on that.
Yeah.
I've been getting my thesis off the ground. I'm actually doing my thesis in pain. I'm looking at pain rehabilitation and boring psychological constructs, which hopefully won't be boring because they will explain some of the reasons why pain can be quite disabling and troubling, besides the fact that it is physical. Sometimes the way we perceive things can make it easier or harder, and if we can make it a little bit easier, that's the end game. Because some of us are never not going to be in pain. We physically can't fix it, so what other options do we have?
And that's what your thesis is going to explore?
Yeah, kind of, like looking at cognitive constructs that might relate to worse pain.
What's a cognitive construct? I have no idea what you're talking about.
Like personality trait or tendency to think a certain way
Okay.
or react a certain way.
Like black and white thinking or...
Kinda, yeah, actually. I'm looking at something called catastrophizing, and that's not saying that people are dramatic or melodramatic or anything like that. It's just saying if pain has hurt in the past, which, it hurts, future pain is scary, and being scared or upset or concerned can bring on pain, or it can make it worse, and the pain is quite obviously very real, but if we can distort and do some Jedi mind tricks, maybe it won't be as bad. Like, yeah, it's a life quality kind of thing.
Okay, that sounds cool.
The best part, though, is that I actually get to inflict pain on first-year volunteers.
Wow, you're doing a, whatever that study was that I just can't remember. You're doing, the one where they pretended to electric shock people?
Milgram? No, not quite. Just cold ice bath instead.
Yes.
It's only like...
Stanford Prison Experiment.
Yeah,
Is that
yeah.
Milgram?
No,
No, that's a
they're
different one.
both. They're both about being awful.
Yeah.
Yeah, no. All I'm doing is asking them to put their hand in a really, really cold basin of water, which they can retract the moment it becomes too much. We just need to cue what pain feels like for healthy people. Apparently, like, you can live and not have pain. And I just don't understand. They need a juice box because they get put in pain because it may shock them.
That's really sweet. That's, that's like when you give blood and you get like a cookie afterwards.
Well, they get the juice before, so they don't faint. Apparently people faint.
Oh, okay.
if they don't have like sugar in their system by putting their hand in an ice bucket.
I'm sure that's probably like the worst case scenario risk, and that probably won't happen.
Touch book.
Yeah, because we don't have wood here.
We don't have wood. There's just a book with the mic on it because
professionalism.
But anyway, what have you been up to, Emma?
Um,
Besides podcasting.
That just made me think I'm planning an excursion for my students, and you have to say like what's the worst risk outcome, and it's like students could run away and get lost, or it's just like really funny to be like, what's the absolute worst thing that could happen?
A Tyrannosaurus Rex eat us all.
Yeah. Not going to that museum though. So
I actually put on a math assignment that one of the parameters for the experiment is a spaceship abducting the participants, and my maths teacher crossed it out and said that's not reasonable.
oh,
I was in year 8. It
What
was
a party
hilarious,
pooper.
right?
that's so
Anyway.
sad. That when you were saying before about your thesis though, that also made me think that often people in pain have a really high pain threshold, but then they also have a really high pain sensitivity.
Yeah,
Which
you can
is
have both.
weird that the idea goes hand in hand, but it's like you feel pain more, but you could feel pain instantly when you put your hand in the bucket of
Absolutely.
ice, but you could keep it there for longer perhaps.
Yes. Chronic pain people aren't actually allowed to do the ice water challenge. They're an excluded criteria because it's not very nice. You're already
And you
in
are
pain.
testing the healthy.
We are. We're looking at healthy people first because science. What I
'Cause
was...
they'll live longer and they're better.
Yeah, they'll live longer, so you know, it's fine.
It's fine.
It's fine. They're kids and healthy. What I was going to say about the acute versus chronic, actually, since we last recorded, I cut open my hand trying to eat an avocado.
You millennial.
Yeah.
You'll never buy a house, Georgia. Never.
Well, I wasn't even buying the avocado on toast. I was doing it myself. DIY avocado toast. And I was really tired, sleep deprived, as a spoonie often is. And missed the mark with the knife. And got the tip of the knife. Sorry, I won't go into much detail. But anyway, the tip of the knife entered my finger. And it's the first time in my life that I've had a tissue acute injury. I've never cut myself open like that. Like, I've fallen off bikes and had scratches and grazes and I've had surgeries, but I've never had something like this. And my God, it is a different kind of pain. And I was like freaking out.
Oh man.
It's very different. I actually thought to myself, like, man, to have a dull ache in my knee right now would be really nice.
Oh.
I'm good now, but I hadn't actually had an acute pain in a long time. And I have a little bit more empathy for normies now.
Yeah, those people that get in accidents.
Mm.
Is your finger okay?
Yeah, it's good. I just don't have great nerve conductance down one side of it.
That's not good.
But it's chill. Emma was like, can you move it and stuff? And I'm like, yeah. But if you pricked me with a needle, there's parts of my finger I wouldn't really feel it.
So just don't go near a knife and an avocado again.
I'm actually really good with knives.
Okay.
I have good knife skills.
Sure.
I was just tired.
Okay. I believe you.
Shush.
I believe you.
You know the worst part about it, Emma, though? I had to throw out the avocado. It was covered in blood.
Ew.
The Uber thought that was funny.
The Uber?
Yeah, to get to my GP to get the stitch.
Oh, you didn't call an ambulance or anything?
No, I wasn't bleeding to death, mate.
Oh, okay.
I just got into an Uber, went to the GP and got it stitched up.
That's cute.
Why would I go to hospital when I could go to my GP?
Yeah.
I wait like 5 hours at hospital.
True dat.
That private health privilege of going to a GP instead, though.
Well, it's not necessarily a private health.
You know what Uber said to make me feel better?
What?
I once had a lady who removed the entire fingertip and had her whole hand wrapped in a towel. And then got into the Uber and was like real nonchalant with him. I know.
I can't even handle you saying that.
I said to the Uber, I'm so
Don't they call it like de-sleeving or something?
That sounds naughty.
No, but it is like a thing.
I believe you.
Oh,
But
no, I don't want to hear it
I
anymore.
was apologising to the Uber about my injury, and then he made me feel better by one-upping it.
Oh,
Yeah.
oh.
Ubers get called a lot instead of Ambos.
I could never be a nurse. Did you see that thing in America? You can now, clinicians and hospitals can now order an Uber to pick up a patient for them and bring them to the hospital.
How good is that?
I hope that happens in Australia.
Because in America, ordering an ambulance is so expensive.
Well, I mean, even in the state next to us, New South Wales, it's not free to have an ambulance.
What?
And that, Yeah, didn't you
New
know that?
South
Well,
Welshman.
it would deter so many people I knew when I lived there from ordering an ambulance because you had to pay for it. It's like the one thing Queensland is progressive on.
Oh my god, that's not okay.
Yeah.
It's not even a little bit okay.
Hmm.
Yeah, I'm just sad
Okay.
about New South Wales now.
No, it's alright.
American spoonies are like, guys, welcome.
We don't even have like proper Medicare.
I love you, Medicare. Never leave me.
Yeah, pretty
But
much.
please get better. Also.
Yeah. On that note, I was just going to segue and say that my pain has been really bad and I can't go 3 months without getting some kind of flare, which is really, really frustrating. Also financially, I have like no money because I'm paying for all these treatments and that's really irritating. And I was going to kind of segue that into talking about our topic today.
Absolutely.
But that I did remember you wanted to talk about the nick first.
Yes, so when we did the history of pain, Emma was talking about something called cocaine sickness and mentioned that there's this TV show called The Nick that looks like early 1900s medicine.
Mm-hmm.
And it is actually really, really good and disturbing.
Yeah.
And yeah, the last scene where they were like,
Of
oh,
the first season?
yeah. I only thought there was one season.
No, there's like 3.
Oh my god, what? I have another 2 seasons to go.
Yeah. It did get cancelled, so I don't think it wrapped up though. But
Anyway, I just wanted to say that like there was this really cool scene that wrapped up the pain history stuff for me because a doctor was in cocaine sickness, as in withdrawal, aka the worst time of his life. And they were like, we'll fix it, have some heroin.
yeah.
And it's just like, that happened.
Yeah.
That was medicine and science.
Yeah.
Have some heroin, friend.
Yeah, it's really scary.
I mean, it could happen still today.
I mean, you think about the drugs that we're given for things and it's like,
Well, yeah, there's a lot of medications. Opioid drugs are now considered a my goodness. The word opioid is now considered a bad word compared to a lot of other treatments to doctors. They don't like it. They don't enjoy it.
mm-hmm.
I know a lot of patients who are afraid of them.
Yeah.
Especially the older generation sometimes. They've seen what it does sometimes, so.
Yeah.
But sometimes you just gotta live.
Yeah, it would be interesting to see in 20 years' time what is considered not good that we use today. I guess, is that sort of your recommend or something you've been up to lately? Because then I was going to talk really quickly about The Immortal Life of Henrietta Lacks.
Yeah.
Which I just showed the trailer for to Georgia. So about 2 years ago, I heard that Oprah, the glorious Oprah, was going to make a movie based on this non-fiction book, sort of like a research book, about the HeLa cells, which is the first immortal cell line that was created ever. And it was created from this woman called Henrietta Lacks. And I found out that a movie with Oprah was being made, read the synopsis and went, oh my goodness, I have to read the book. I listened to it on Audible. Totally recommend you listen to it on Audible because they have different characters' voices and it's really lovely.
I'm absolutely going to give it a go.
But basically it's like such a spoony injustice story. Not spoiling anything. This is basically what the movie follows, is that Henrietta Lacks was a sort of lower class African-American woman in the 1950s. She got cervical cancer and was treated at Johns Hopkins Hospital. Her cells were then taken without her knowledge, and then afterwards she passed away from her cancer. Her cells were then sort of, I guess, experimented on and used to create the first immortal cell line, and they were known as HeLa cells, H-E-L-A, because of Henrietta Lacks. HeLa. And then HeLa cells have helped pave the way for cancer treatments to do with HIV and AIDS treatments, and then also helped make the polio vaccine. And her family had no idea that this happened, and they never received any compensation. And the biggest part is that her cells were taken without her consent. It's still a medical issue that is really relevant today, and even in 2013, her cells were sequenced. I don't know if all I was going to say is I don't know if that's the right, like, verb. So I'm going to say her genome was sequenced from her cells without her family's consent. So it's a really fascinating look. And if you're able to read the book, or it is quite a big book, so if you're not into it, I really recommend watching the movie. It's on YouTube and at HBO now at the moment, I think, and at least in Australia. And then there's some free screenings. So I'm not sure if it's going to all cinemas, but I know it's going to a gallery here that we're going to go to. But it's such an amazing book, and the family history and the injustices that they went through, it's really frightening about what happens to people's medical, I guess, consent and privacy.
Well, and the idea is legally that once a part of your body was collected then, and still now for a lot of places, it's considered consensual to do what medicine likes with those parts of your body.
Yeah. Her cells have gone to space. They sent them in space.
I think it's part of the reason why the story was so interesting to me is that her family didn't realise that how many lives she'd saved.
No, because nobody told them.
I know.
And they never gained permission.
And I just think for me that would have been a great comfort eventually when I was ready to kind of mourn, you know, a family member, like, for example, my mother, knowing that, you know, her suffering, well, it wasn't justified. And no, they shouldn't have stole her cells, but, you know, your family legacy is that so many people lived because of your cells. Like, polio vaccine, come on.
Yeah.
Emma and I grew up in a time that polio wasn't even a concern.
No.
It used to kill so many kids, and, you know, parents would fear polio.
Mm-hmm. Yeah, and I mean, that's the attitude that our family has taken, which I think is very gracious of them.
Absolutely.
Considering how unjust everything was.
Yeah, it's so unjust.
But yeah, I would really recommend that. Shall we transition to talking about Velcro?
Yeah.
No, we're not talking about Velcro.
Skippers, we're talking about the stuff now, so you need to stop skipping.
Yes. So today's episode is called the V word, or it should probably be called the V words, because there are many words starting with V, many conditions starting with the letter V that we should talk about. It's like Sesame Street. The letter of the day, kids, is V. I wish I could do like a
1, 2, Okay, I'll stop. No one wants to hear that.
And so today we are talking about pain conditions that relate to the vagina and the vulva.
Mm-hmm.
And as I was thinking about this, like, obviously we're going to be talking about things from an anatomical and medical point of view today. We're not going to be talking about anything salacious. So if there are any, like, younger listeners, or if you're listening with your children and you don't want them to hear stuff about this just yet, maybe this isn't the episode for you, but that's your choice. But we're not going to be going really into depth about issues with intimacy just because we are sort of, I guess, a PG podcast.
Emma's focused more on the construction of the vagina and the vulva and why it can sometimes go wrong, rather than, you know, sexual facets to it. So
yeah. Oh, it just feels very feminist to do this. We're recording just after International Women's Day.
Yeah.
And actually having a podcast where you can say the words vagina and vulva. Like, even, you know, on TV, those words get bleeped out in Australia, but you can say penis, and that's fine. And, you know, we do see them as private parts or private words, but it is sort of a feminist act even to just say those words. This is a gender-inclusive podcast and a gender-inclusive episode. While a lot of the info that you'll come across does refer to simply women's issues, we're going to try and be more broad than that when it comes to these conditions. So, the V word. We're talking about vulvodynia and vaginismus mostly today. A little bit about vaginal tearing as well. This is a pain that around 16% of women will have, where their pain in these areas lasts longer than 3 months, which
that's really high.
It's a pretty high thing. And I think when I first found out that I had these issues, I felt so alone. But then to know that actually most women who have these conditions are young.
Yeah.
It's not mostly women who say are, like, you know, in their middle age and it's something menopausal or something that women have had during childbirth is quite, like, interesting.
Well, everyone kind of attributes those problems to she gave birth or she's getting older, and it's winding down, and that's
Yeah.
really not the case here, is what you're saying.
Yeah, basically. And so the good thing to kind of be really positive about for this episode is that we are going to be detailing some things that to a lot of people will sound really upsetting and distressing to know that people deal with these kinds of pain. But it is actually a pain. These pain conditions can pretty much be rehabilitated, not to say cured, but they can be lessened or even stopped through a combination of treatments. Unlike a lot of other pain conditions like EDS, my pelvic pain, where there is kind of no end in sight.
Your organs are just like, nah, mate.
We're here forever, mate.
Yeah, mate, you're stuck.
Mate.
Mate.
Whereas these pain conditions can be worked through, which is pretty rad.
That's good news.
Yeah, and I mean, in the last year, I have actually seen a decrease in my pain, and to have that actually happen to me, so it's like a real thing and not just some fairy tale that I've heard can happen, has been pretty, very, like, rewarding. The other thing to note is that vulvodynia, vaginismus, any conditions like that, has nothing to do with the amount of sexual activity one participates in. It's not a punishment for having sexual activity or sexual intercourse, and it's different to an STI. So these conditions...
That's very important. Can you say it again?
It's not an STI.
Thank you.
Yep. Lots of people first think it is going to be something else, like an STI or a UTI.
Which is, it's never a bad idea to rule that out.
Yeah, like, get yourself tested for STIs. That's really important.
Get the smear or urine test and just rule it out, friend.
Yeah. The other day someone was like, what'd you smear on your bagel today? And I was like, you use the word smear? Who uses that word in a non-medical context?
I just think of a pap smear every time.
Exactly. I was like, poor choice of words.
Yeah.
And hi to that person who's probably listening. That was a really good moment, wasn't it? So first up, we're going to talk about the two conditions, vulvodynia and vaginismus. Then we're going to hear some listener submissions. Georgia's just going a bit nuts because I made her a nice cup of tea.
So good.
It's twinings, passion fruit and hibiscus. Yeah, it's really good, right?
This is pleasure time.
I forgot my tea was there. Well, speaking about pleasure time, let's talk about vulvas that are in pain. Woo!
None of that 50 Shades of Grey attitude, please.
No.
So, vulvodynia said vulvodynia.
Oh, you don't have to say that part because you said it right.
No, it's more just to really break it down because that looks like a scary word for some people.
Yeah.
And it's a scary word because it's spelt fascinatingly, but also it's part of the reproductive organs. So, people get a bit spooked.
Okay, continue. Vulvodynia.
It's a condition where there is pain, burning, and discomfort in the vulva. What is the vulva? Well, the vulva is the area of skin between your legs. It includes the labia, which are the flaps of the skin that surround the opening of the vagina. There are many different conditions that can make this area painful or irritated. It may be painful due to an infection such as thrush, and I'm sure people who don't experience vulvodynia can at least think of maybe one time they've had thrush. It's not great. It may be due to a skin condition like dermatitis or lichen sclerosis.
Mm-hmm. And if you're still kind of confused about exactly what the vulva pertains to, because as we know, most people generally call that area the vagina. When
Skin flaps.
Skin flaps, or sometimes often call them the lips.
Yeah.
So you can think of, the two lips there.
Yeah.
Okay.
However, sometimes the vulva can be painful without any infection or skin condition being present.
And usually that is the case for myself and most people I know with vulvodynia.
That's the chronic part.
Yeah, there is no infection or thrush.
There's nothing that logically can, be fixed quickly. To make it even more complicated, sometimes all these conditions are present at the same time or at different times in the same person. It's also common to have other types of pelvic pain as well. Yeah. Why not collect them all?
Gotta catch 'em all.
Yeah.
Pokemon.
Pain conditions. Some women with I can't say that.
Vestibulodynia.
Vestibulodynia? Did I get
like
it?
The vestibule.
So it's an area of redness at the vaginal opening, But this is not a reliable sign, as every woman's vulva looks different. Or persons.
Sorry, I forgot to change that word.
That's okay. We're growing, we're learning. So every person's vulva will look different. And in some cases, vulva pain, the vulva looks completely normal, not discolored, no sores, nothing like that. Just looks normal. And it's a chronic condition that can last months or years. Some women, it can be so uncomfortable that sitting for long periods, using tampons or having sex is difficult or impossible.
So, as we said before, that vulvodynia can affect women at any age, but it is most common in young women who have had pain during sex and aren't often able to have penetrative sex at all. And this is sometimes called provoked vulvodynia. Now, there are kind of three types that of this type of pain that you can separate them into. It's called vulvodynia, vestibulitis, vulvodynia, or clitoridynia. But honestly, most people just call it vulvodynia or vaginismus.
Collectively.
Which is why we're sort of just grouping them in today. Yeah. And there is no special test for vulvodynia. The only test to prove the pain is not caused by other conditions. There is usually what they call a swab test. They'll simply just get a cotton bud, like ones you use to clean out your ears, and they'll just lightly put it against the vaginal opening and the vulva with a very light touch. And if there's pain there, that's where they can sort of say, okay, we think you have vulvodynia there. Yeah. But it's not going to come up in blood tests or anything like that. No. It is an invisible pain. Unfortunately, not all doctors are familiar with vulvodynia, as we'll hear from our listener submissions today. Sometimes they will conclude that a person's vulva pain is caused by a psychological problem. If you cannot get relief from that vulva pain or you want a second opinion, usually you go to what we call a women's health specialist or a gynecologist. That's really where you're going to find help. And for the most part, yeah, it's all in your head. Are you giving into it? It's a lot of, is there something psychologically wrong with you?
Yeah. I've heard a story of a friend of this kind of stuff, and yeah, it's...
The words used to describe vulva pain include burning, tearing, splitting, stabbing, feeling raw, and sometimes itchiness or stinging, because it is a nerve pain, okay? Sometimes you can feel itchiness instead of pain, and it's like, what is happening?
Yeah.
Uncontrollable itchiness, which is kind of interesting, like...
Well, nerve pain anywhere in the body can make no sense. Like, I once said that it felt like I had a container of ice poured into my gynae areas or my tummy. And the doctor looked at me like I was a bit different. But that's what it felt like.
Yeah.
Ice.
And it is very hard to describe pain.
How do you describe nerve pain especially? It's very strange.
So, vulvodynia, as with vaginismus, can affect libido and pleasure responses, but these can be rewired. So, of course, if you're in pain, some people can feel pain upon arousal. So that can obviously, conflict and make things issue in regards to feeling sexual pleasure. But that dulled response, it's very different to not experiencing sexual attraction. For example, being on the ace or asexual spectrum or demi-spectrum. It's different to that. And it's very frustrating and heartbreaking for the people who are allosexual, people who do feel sexual attraction, to want to feel desire and be active in that, but not be able to for certain ways. And we are going to discuss a few ways that you can be fulfilling some pleasure in a way that isn't going to cause pain later. Yeah, so the main thing that I want to take away from this today is that, honestly, everyone's automatic reaction to when I've told them that I have this, and I don't talk about it with my extended family much, say, because you just don't talk about your vagina with, like, grandma.
No.
Not like, hey, grandma, let me tell you about this pain. That just doesn't happen. But for even friends who I've told it, like, I had someone who I told cry at me because she felt so sorry for me that there were things that I couldn't do. And the response is always like, oh, gosh, this is awful, because pleasure is such a big part of people's lives for the large majority of people. And I don't want this to be like a sad podcast episode where it's like, gosh, these conditions are so awful and it's so hard, because there are ways through it, and you can still, like, you do lead your life in every other way regardless.
Yeah.
So it's, even though we are saying things that are a little bit like
Bummer City.
Bummer City. You know.
No, it's Vagina City, not Bummer City.
Yeah.
That was
This is
so
why
bad.
that's why I keep you around, Georgia, for those beautiful puns. So yeah, don't I don't know. We'll have to try and get ways to inject more levity into this.
Yeah, so shall I go into vaginismus now?
Please dive right in.
Speaking of diving in,
Oh God.
so vaginismus is slightly different to vulvodynia. So part of the reason why vaginismus can occur is, for example, if intercourse has been painful, the pelvic floor muscles which wrap around the vagina and tighten up and close it protectively. And it can all start with something pretty harmless, like a thrush infection, dry sex, a bladder infection. And what happens is the sensors in the skin or bladder start sending lots of messages to the brain, distress signals to the brain. And if the brain decides that there is a threat or a danger, things can start to spiral out of control and a cycle of chronic pain begins. This threat response of danger, let's, contract and have some nerve pain signals can often happen unconsciously and repetitively and for causes that most lay people wouldn't cause that pain.
Yeah. I'm trying to think of like a good
Rubber
analogy.
band?
No, I'm not a rubber. What's something that contracts that's like a jellyfish, okay?
Well, that's what your hand looked like.
Yeah, okay. So I'm doing hand movements. It's like a jellyfish. Like a jellyfish just kind of darts up when it's trying to swim up top. Okay, picture the jellyfish from Finding Nemo. Touch it.
It's just darting really quickly upwards, and it's not happy.
Yeah.
And it's angry and it's stinging.
Okay, calm down. It's not that emotional. But yeah, so the jellyfish is kind of contracting, and that can happen without you even realizing it. And it's not like you're God. You're like, oh God, danger! I need to run out of here. Like your body is just doing it without you realizing.
Yeah.
It's not something that is like you panicking. It can happen very, very smallly. So on to that. What are the causes of vulvodynia and vaginismus? There are lots of conditions that are often comorbid, but as Georgia said earlier, there isn't one sort of cause, and it often seems to happen out of nowhere with a nerve pain kind of issue where can often be comorbid with interstitial cystitis, which is what I have. It's now called painful bladder syndrome.
So romantic.
I know. I wish it was called interstitial cystitis again. Fibromyalgia and other pelvic pain issues. It can also be caused by if there is a traumatic childbirth or vaginal tearing. That can set things off. And I'm just going to put a quick trigger warning because we're going to discuss for under a minute, 30 seconds, really quickly about sexual abuse.
Mm-hmm.
So that most women do not have the condition as a result of sexual trauma, but these conditions can be caused by trauma. Because obviously if trauma does occur in the vagina, that your body could be reacting to a danger threat, but it's not, the body is reacting as it can, but you are not overreacting if that was the case for why you have those issues. But mostly people do not have that as a cause. I do not have as a cause, but honestly I went through a period when I was first being diagnosed with this pain and realizing it was really impacting my life, where so many doctors would ask me, are you sure that something hadn't happened, that I second guessed myself, and I was like, oh gosh,
that's
do I have repressed memories that I'm not sure about, which is like a whole other, as I'm sure Georgia can talk about, repressed memories are very controversial. But it's such an idea that this would happen, and honestly most people I meet, it's either they're young like me, and honestly that isn't the case. And it's okay if that is the case, that is your reason. It's either that or childbirth. It's either it's just something that happened or childbirth. But, if a doctor says to you, okay, well, something must have happened back when you were little.
That's so awful.
That's not the case, okay? Yeah, but that is usually what people think of. I think that's maybe why people are afraid to talk about it too, because they don't want to be like, did something happen to you when you were younger, or did
It's kind of like you just want to say to people, my body is just trying to do its best, and this was the result.
Yeah, pretty much.
It was just trying to protect me, and it just got a bit too overzealous.
Yeah, and good on our bodies and our brains for doing things like that.
Yeah, it's mainly adaptive.
Yeah.
Mainly, not always, as we all know.
Yeah. So yeah, trigger warning moment over. we've spoken about vulvodynia, vaginismus, basically detailed what they're about.
Quick textbook lesson.
Thank you. We're now going to hear some listener submissions. We have 4 of them, which is lovely. Thank you to Caitlin, Fionn, Alex and Jaime for sending in their submissions. We're now going to hear their perspectives on their V conditions. So, do you want to start with Caitlin Hall?
Yeah.
Thank you, Caitlin.
So Caitlin has sent in, I have vulvodynia and pelvic floor dysfunction. 2 different things, but they are like sisters who want to hang out all the time. They know how to push each other's buttons, so I have to treat them both cautiously and effectively. My diagnosing journey has been less emotionally painful than some I've heard about. I'm very grateful, but I'm absolutely shocked by the number of medical professionals, especially women, who don't really know all there is about female reproductive health and the pain that comes with it. I have had a female doctor tell me it's in my head. When I finally told my primary doctor that sex didn't feel right, she actually asked me if I really loved my husband.
That's awful.
Oh my goodness.
Oh my gosh.
Her words of advice were to relax. You can't really relax with an undiagnosed medical condition such as pelvic floor dysfunction and vulvodynia. That's pretty spot on.
I love Caitlin.
I hadn't even heard of those at the time. I thought maybe I was just tight and it was painful and I was having horrible infection symptoms for months. Oh my goodness. Even a gyno I went to didn't have much info for me. It was humiliating. She told me to lube up and use coconut oil. They kept testing me for STDs. I had been tested. No new partners. I've never had any STD. They couldn't really tell me if I had a yeast infection. They kind of shudder and kept putting me to antibiotics, which I'm sure didn't help. It was very clear they didn't know what they were doing and just made me feel dirty and like they didn't trust me when I told me I was only with my husband. I left more confused and hopeless until I broke down and called my family for help. I was so mortified to talk to them about my sex life and all the problems I was having. Luckily, my parents helped me find some specialists where I am now. It's still a process, but I don't feel so hopeless anymore. I think what I wish people really knew more than anything is my sex life, married or not, is none of your business. Why? Because of vulvodynia. I can't really have sex. Ha! And it shouldn't be anyway, but people act like they can know because they assume you are doing it. I mean, hey, I can try, but it hurts. I dread it. I haven't had sex in almost 3 years. Most people assume because I'm married and have a child, I'm just having sex like a rabbit, but that's never been my story, and I don't think it ever will be. My body is getting better, but I wasn't born with a vagina that lets me really enjoy sex, and I have to grieve that. I'm hoping that I will be cured one day, and yes, at least I'm a mother by surprise. I try to remember what I do have, but this has been very trying for me. It's changed me. It's made me depressed. It's made me feel less than. Vulvodynia may be the most undiagnosed condition out there for women, and that's what I really want people to understand. I think women try and hide this because society does not allow for sexual imperfections. We have to be hot and on top. No pun intended. There are so many like me out there hurting and alone, and they don't know who to talk to. Hope this helps.
Thank you so much, Caitlin.
Thank you, Caitlin, very much for sharing with us.
Yeah, I think where she says that society doesn't allow for it, one thing that I really struggled with for a long time is that, you know, being like a young feminist person, it's all about being sex positive and being like, yeah, we just got into like the sexual revolution. Yes, it's good to have sex and be really open about all that stuff. And I've had this conversation with an ace friend of mine too, because it's kind of like you don't quite feel like you fit in where you're like, well, wait a second, I don't want to have sex, or wait a second, I actually experience pain. It kind of feels like there's almost not a lot of room for that.
Yeah.
Because people don't want you, not that you're prudish at all, like that's what I would not want people to think of me, but you know, it's that idea, that stigma.
Empowerment should come on all levels. It shouldn't just be those who are comfortable and doing it like rabbits.
Yeah, and I think, like, the same thing is, like, you know, where people, you know, the feminist movement is very, like, embrace your periods, like, girl power, and it's, like, the uterus thing, and that's sort of why, like...
Uteruses aren't always cuterus.
Uteruses are not always cuterus, and I think we need to the mainstream feminist movement needs to get better at that.
Let's get inclusive. Let's include people who don't feel like it's an empowering time for them, that it's actually quite traumatic.
Exactly. So we now have a submission from Finn, and I need to double check how Finn said to pronounce the word hello, because it was in Russian and I've forgotten how to do it already.
That's
So
awesome.
give me 2 seconds.
In Russia.
Alright. So Finn says hello in Russian. Привет! Let's hope that was correct. I'm Finn, and I was assigned female at birth. I am transitioning medically to present more masculine, though I do not have a gender. You can use they, them pronouns to refer to me. I have had incredible vulva pain for the last 6 or 7 years, though it was definitely present in the years before that. I suspect my underlying issue is vulvar vestibular syndrome, VVS, also known as vulvodynia. You could say that with a Russian accent. Vulvodynia. Vulva vestibular.
Sorry, I'm laughing at Emma, not
Yeah,
the story.
Of course. I think that's clear. Finn says, like so much pain that affects people with vaginas, it's not certain what causes the pain, but it's posited that the nerves in the vulval vestibule are overactive, causing even the lightest of touches to be like fire. When condition flares up, I feel like I have to pee constantly, and any contact at all with the area feels like I'm being stabbed. And even when it's mostly functional, I can't use things like tampons or other insertables. Penetrative sex obviously causes me pain, though the severity varies. Confounding this, though, is a confirmed diagnosis of post-herpetic neuralgia, which is nerve damage that commonly occurs after a shingles outbreak. Oh my gosh, shingles are so harsh. In 2012, I had shingles on and around my vestibule and didn't actually get help or treatment for it until about 2014, which means, yes, that I had a fairly consistent shingles outbreak for about 2 years. It was exactly as much hell as you're imagining. Pro tip, don't listen to anyone who tells you to fear and hate doctors like I did. That will just prolong your pain. It took me 6 years and 5 doctors to get to where I am now. I am on medication to clear out a UTI, but my doctor also prescribed Lyrica to help with the neuralgia. My final dosage won't be settled until the UTI is gone, but I'm already getting some relief from the pain. One completely false thing a doctor told me was that shingles and herpes are the same thing.
Mm-mm.
Spoiler, they're not. Shingles is called herpes zoster, but it is not sexually transmitted and only occurs if you've had chickenpox sometimes previously. It sits at the base of your spine like some kind of eldritch being, waiting for your immune function to get low enough to force an outbreak, though that's thankfully uncommon. If you've been diagnosed with herpes because of open sores on your genitals, ask to see the swab results. You may have had shingles instead, and your pain may be caused in part by nerve damage. It's treatable, and you don't just have to muscle through it. Recently, I was talking with my friend who is also a trans man, meaning he was assigned female at birth based on his genitals. My pain feels a lot like a UTI, so when I get a flare-up, I only go to a doctor for help if the pain lasts longer than 3 to 5 days. My friend was frankly horrified. When he gets a UTI, he takes time off work because the pain impacts his productivity, whereas I just kind of keep going. This is not to try to say that I'm somehow better than him. It just goes to show how easy it is for those of us with vulvar pain to ignore it and struggle through, because such regular occurrences desensitize our ability to judge and how appropriate our reaction is. Basically, my point is this. Your pain is 100% real and you are not exaggerating it, no matter what you or others may think. More importantly, it can be treated. Don't accept anyone who tells you just to relax or just deal with it. No amount of foreplay or lube can make me feel less pain with sex, and no amount of water or whatever miracle cure people advocate stops the incessant need to pee and the pain that comes with that. Believe me, I have tried a lot. But have you tried yoga? There are doctors who can help. The ones who don't are at best lazy and need to educate themselves. Solutions exist. You don't have to be in pain forever. What? Can I get a whoop for Finn? That was a great way to end that.
Thank you so much, Finn.
You're being too sad about this.
I know.
Cheer up.
No.
Cheer up.
Cheer up.
Cheer up. It's not that sad. Don't be like, oh,
Say the funny Russian
sad
word again.
things. Vulvodynia. Okay, we're now going to hear from Alex.
Yeah, so I'll read this one. Okay, so Alex says, I was diagnosed with vaginismus late last year. I've never been able to use tampons, and penetrative sex was painful. I always thought that painful penetrative sex was normal, but as I got older, I realized that that's not true. On a hunch, I googled my symptoms and found that they matched vaginismus and went to my GP where she confirmed it. She referred to my physio, who specialises in women's health and pelvic pain. I have exercises that I do with dilators to get me used to having something in my vagina and to reaffirm that I am in complete control and there's nothing to be worried about. Vaginismus is a physical reaction, spasm of muscles, but it can be caused by anxious being worried about sex or penetration, and it is something that I can recover from. I'm happy it has a name and that there are other people out there like me. Thanks, Alex.
Thank you, Alex. I've spoken to Alex before, and one thing that we can both attest to is that if you feel like your pain is static and you'll never get rid of it, that we personally have both experienced desensitization, and less pain from these treatments, and we're going to talk about treatments in just a second. So Alex is another example where it's like you don't have to mourn your vagina and have a funeral for it. The last submission comes from Jaime, and Jaime sent us in a voice clip.
Hi, this is Jaime from IToldYouIWasSick.com. My first experience with what I like to call chronic crotch issues happened when I was in my early 20s. I'd had a bout of bacterial vaginosis, and even though it had cleared up, I developed a serious latex allergy and chronic urethra pain overnight. I was told over and over by well-meaning friends and relatives that I just had a UTI. No such luck. A UTI would have been easy to clear up. This was constant urethra and vulvar pain. Oh, and TMI warning. I also had a chronic thick discharge that issued from my vagina all the time. However, after countless tests on the stuff, I always came up clean with no sexually transmitted diseases. I was finally told by a doctor over 10 years ago that my body acts as though I have a yeast infection all the time, even though I don't. So basically, that discharge was my immune system going haywire, trying to heal whatever imbalance was going on down there. Now that I'm in my late 30s, my chronic urethra, vulvar, and cervical pain has lessened significantly, but I can get a flare from the slightest offense, meaning using the wrong pad, the wrong tampon, the wrong soap, etc. Even what I eat makes a difference. Here's what I believe about my chronic crotch issues. I'm autistic, and I have celiac disease. This means my gut bacteria has always been off. And from what I've researched over the years, people who have gut issues often have crotch issues. Through dietary changes, being very careful what gets near me down there, and a few natural remedies I've experimented with, I've managed to keep it under control, for the most part. However, it still affects me emotionally. It used to curl me into a sobbing, sexually frustrated ball, and I understand exactly what it's like to have this pain. It's more than pain. It can feel like invalidation as a woman, or a man, or any sexual being, and it can do a lot of damage to your self-confidence. If you're going through this, you are not alone, and you are not crazy. Your symptoms are very real and very valid. Don't let anyone, especially not a doctor, tell you differently.
Wow. Thank you so much. That was perfect.
Can't even say it better ourselves.
No.
Let's just end episode.
Yeah, we're just kind of we had the recording playing and thank you. That's really well done.
Yeah, and you can find Jaime on Instagram as well as her website. It's called I Told You I Was Sick. So you can find her there too, which is how she found out to send.
Cool. Thanks for finding us on the interwebs.
Yeah. You are so well spoken.
I know.
I think it's also probably because we're Australian too. We're like, Rah.
It's so well enunciated. I was
Enunciated.
I was wondering if it was a computer, and then I heard a breath, and I was like, no, they just have such a lovely, even tone.
Yeah. We're now going to talk about treatments. What are the things you can do? And some of our listeners have hinted at some ways that you can treat these conditions. So usually a combination of obviously taking care of your parts, using medication to reduce nerve pathway pain, and also physiotherapy. That kind of holistic approach is the best way that you're going to get relief. Here are some general tips that you can use is that Wearing comfortable cotton underwear. Try to minimize wearing things like G-strings, tight jeans, and pantyhose if you can. I was having a discussion with a bunch of friends the other day saying that often, traditionally, you know, men's underwear in the men's section of stores often can be quite comfortable.
And cotton.
Yes, and cotton. It is...
Cotton is good for everyone. Everyone should be wearing cotton.
Yeah.
Let it hair.
It's comfy. Hello, Mickey.
Cat. Purr into the mic.
Mickey. I can't make him speak on command. Just sit down, dude. I need to keep going. Sit.
Okay.
All right. What was I saying?
Underwear.
Yeah. There are these like so-called period panties called Thinks from the company She Thinks. The company is kind of really sketchy on their like
Composition of the material?
Oh no, it's got nothing to do with that actually.
Oh.
Although they only do have one underwear that is actually like fully cotton. The other ones are only not quite cotton, so they're not going to be that useful if you have areas that are easily irritated. No, the company got into a lot of hot water for their CEO, basically having like sexual harassment claims, and also really bad like maternity leave policies. And this was a female CEO.
My God.
So I would say rather than like using Thinks, if you think like something that's like a period panty, if you have lots of discharge or heavy periods that are related to your conditions, rather than them, try one like Modi Body, which is Australian. They do exactly the same thing. They're really comfy. I have a couple of pairs and they're really cool so far, and they're Aussie.
Do they work?
I haven't tried them because I've been a bit too scared for like, you know, the period thing, because it's meant to like absorb, say, like a tampon's worth of period
I
blood.
would be spooked.
I think, you know, you could always try it like when you're home, so it's not a big deal. But I think just, you know, if you get lots of discharge and it's like hard to clean it off other underwear, that could probably be like a really good thing. Or if you have incontinence, which sometimes people with vulva and vaginal issues can have, mostly they don't. But if that's an issue, those can be really good too.
What else?
Okay,
what else can I
is
try?
there? Stop talking about underwear, Emma. You can buy special seat cushions that have like the middle cutout. So if you're at work and you don't want to have something resting on your areas, that can be really helpful. Stops you from slumping over too if you're in pain. You can use topical compound creams or barrier creams to help prevent infection like dermies. Also, we've spoken about this before. Have we? Yeah, I'm pretty sure I did on like one of our first episodes.
About not douching and stuff like that?
Yeah, don't put soap down there. Wash only with water, and generally for your body, if you're really sensitive, use your soap alternatives like QV, Cetaphil, or Dermavine. And one thing that is suggested and can be quite hard in our, you know, hair-free society, but they do say limit your pubic hair removal so that you're not going to cause irritants.
Yeah, and expose the sensitive parts too. Wouldn't that act as a barrier to protect it?
Yeah.
In a way?
Yeah, I don't know. I think just do what you feel right in regards to there. So physiotherapy for vulval and vaginal pain is really helpful. And this is what I have been using and I have seen results from, is that basically an experienced physiotherapist in this area can teach you how to relax your sore, tight muscles of the pelvis and inside the vagina. So one thing that I would really recommend happening is that if you have vulvodynia as well as vaginismus, which is what I have, and that's not always the case. I first went to a physiotherapist who got me straight away using dilators. And don't make that face, Georgia. It's not that hard. It's not scary. It's just like a little plasticky kind of tube.
Okay.
They're really, really small, like basically the size of like a pinky finger to start.
Yep.
And then you move up levels.
I see.
As you are able to progress the sizes as your body relaxes and gets bigger. So it is able to encompass more sizing.
Okay.
It's not scary. They're very gentle and easy to use. But I got taught to use that right away. And that was not good for me because it did nothing for my vulva pain. So at present, I'm treating my vulva pain with desensitization, which is just real light touches. And then you can progress from there. So I would really recommend going to someone who feels like they are going to really help. And if you're in Brisbane and you're looking for someone, contact me, because I know at least 3 physiotherapists who will teach you the right way to use these things.
Rome wasn't built in a day is the message you're trying to give.
Yeah, it does take a lot of time. And what was I going to add? And you might think, oh, that's something I could just do myself. But from experience, it's better, and you get more motivated if someone is checking on that you're actually doing the progress. And you don't want to do, the last thing you want to do is do it wrong and hurt yourself.
Yeah.
The other thing I wanted to add is that when we were posting like our calls for submissions about this episode, this company who make pink dilators that are magnetic,
Targeted ad.
liked us, liked the post, and like if you remember from our unsolicited advice episode, we talked a lot about how magnets have no actual proof of doing a lot of stuff
Ions.
in the air. The
Science.
magnetic fields in the earth.
Science words.
Science. So magnetic dilators, the magnets will not provide any more relief. They haven't been scientifically backed. And really, the goal of having pink dilators I find quite rude. But so when we're talking about a dilator set here, we're not talking about a toy used in sexual intercourse. We are using about something that has been a medical grade set. They aren't too expensive, but you want to make sure that you're actually getting them from a website that is promoting helping these conditions, and don't get it from a local shop. You want it to be legit and also to be made of good quality material.
Yeah.
Blah blah blah. Some other stuff is that you can use specialized TENS machines, such as the Ova, Livia, or Pelvitone. Those are a few of them out there. Avoid exercises that hurt you. So doing things like Pilates. Hey, so maybe yoga is okay, but don't use Pilates for this, because you don't want things that are trying to strengthen your core muscles. You really want to work on them actually being relaxed, because they are so tense automatically.
It's funny you mention that, because no one ever considered that my pelvic pain is obviously not vaginal based, but no one stopped to think about that when they were like pelvic floor strengthening. Like no one was like, maybe that's a bad idea. Everyone was pro the strengthening. And I can imagine other people have had that same problem.
Yeah, and I mean, a lot of exercise that you can do is based on strengthening your core, but something like, for example, like swing dancing, or really yoga as well, something that's going to be really calming and making your area really flexy, and it's not about being tight. That can be those are some good exercises. Or even walking, that's going to be helpful. The worst thing you can do is like sit and curl up and just leave everything. You got to keep your body moving, and of course use a heat pack or a hot bath when the pain is severe. So George is going to talk now a little bit about the pain psychology and medical treatments.
So, living with vulvar pain syndrome can have a negative impact on self-esteem, mood, and anxiety. Research shows us that depression and anxiety make pain more difficult to manage and even intensify feelings of pain. Kind of part of my thesis. An experienced pain psychologist can help people learn how to better manage their pain, improve their relaxation techniques, reduce anxiety, and improve their mood and feelings of well-being. So looking at that holistic, all angles approach is a good idea. Other treatments, you can get nerve blocks, and you can get botulinum toxin injections.
Botox, basically.
Botox. Pelvic Botox, they call it. Some women respond well to ultrasound-guided injections of local anaesthetic into entrapped nerves. With the Botox or Dysport injections to pelvic floor muscles, they can help women to progress with physiotherapy and therefore reduce their vulval pain.
And in regards to Botox, it's not like where you're freezing your face.
No.
It's actually relaxing the really tight muscles.
It's about the functional use of that area of the body rather than lifting and tucking. And using a small dose of something called amitriptyline or other nerve stabilizers. So this is where things like Lyrica can come in and other things like that.
Yeah. So people do see some relief with pain from that. Some people don't. It's really, as everything is, it's very individual.
Yeah, unfortunately it is. So with intimacy in relationships, unfortunately, people do collude those two together, and they can't see that, you know, a woman's health or a person's health with a vagina is extraneous to their sex life. Some tips include explaining to your partner that you should avoid vaginal intercourse until the muscles improve. Obviously, activity without penetration is fine if you're comfortable with it.
Mm-hmm. And that's a big thing, just to kind of say again, is that Google is your friend here. Think of all the other things that you can do, and the world is your oyster.
Creativity.
Yes,
time.
creativity is key.
Using water-based lubricants or intimate cream, such as olive or bee, during intercourse. And also using the vaginal trainer dilator to teach the muscles to relax, which had been mentioned previously. Another option is something called sex therapy. So women or people with vulvar pain syndromes often struggle with sexual and relationship problems as a consequence of their pain. Think low libido, pain with arousal, decreased arousal, and lack of orgasm. And it can be a cycle that sex therapists can help women and their partner to break. Sex therapists can help couples find a way to engage in non-painful sexual activity and improve intimacy. The good feelings such intimacy and pleasure generate can also reduce pain. So if you can get that going, perhaps you can make the burden of the pain a bit better. Dating when in pain is going to be hard. Try and be upfront and suggest alternative activities, as was mentioned. Google is your friend. Mm-hmm. You can make it even a game of like, what else can we try today?
Yeah. The Australian...
Make it spicy, you know?
Spice it up. The Australian Triple J podcast, The Hookup, which is basically like a relationships kind of podcast. They actually had an episode on vaginismus the year before, and I'll link to it in our episode notes. They actually have a whole episode on people talking about their experiences in relationships and vaginismus. It's really awesome. Unfortunately, it doesn't really go into people who are on the dating scene, single Pringles, but being upfront and suggesting alternative activities is probably the best thing that you can do. And if someone doesn't understand it and is like, what do you mean I can't do that? They're not worth your time.
No.
Because they don't have the mental flexibility that is required to be a nice human being.
Also, that implies a lack of respect for you.
Yeah, exactly. And it should not be that, say you can't have penetrative sex. It doesn't mean that you are simply the giver the entire time.
No.
It should be equal.
Oh my god, no. Sorry, I'll get my feminist hat on here.
Yeah?
Yeah.
Where's your feminist ramble?
No, can we all
sighing?
just share the time in the bed?
But the patriarchy. Anyways, so now we're going to talk, I really want to go through these really quick.
Goddamn
because
Hollywood.
It's so funny. There are some things, we're just going to really end it on, some things not to put down there. Whoever you are, don't put these things down there, whether you have pain or not.
Can we also, stop marketing them? It's shady as heck.
Yeah. Soap. You do not need to wash your intimate areas with soap.
This goes for everybody, by the way. No soap. No soap.
Feminine hygiene washes. I get the idea maybe if you're a spoonie and you've struggled and you haven't showered for a while and you do need to use them to clean yourself down there, like that, like as a rare thing, that's fine. But you're not doing that every time you have your period. That's...
Not on the daily, especially.
No. They can be really irritating and you don't need them. So including washes. Avoid feminine hygiene sprays, wipes or powders, and try using unscented toilet paper, pads and tampons. Thick ply is your friend. Don't put Vaseline down there. And number 1, do not put yogurt down there.
That's a really great way to get thrush. Do you want thrush? Because that's how you get thrush.
Well, I was Googling research for this podcast and this hippy dippy person on the internet was like, a great probiotic to help with a UTI is to put yogurt over there.
Don't do that. That's a great way to grow an infection.
What flavour yogurt would you choose?
Vanilla. What about you?
Vanilla. Oh, passion fruit. Come on.
Nah. Vanilla only.
I mean, vanilla is the most non-irritating. Don't put yogurt down there, people.
Especially, just don't.
Don't. That's
Don't
not going to...
No, the only place yogurt should ever go is in your mouth and occasionally on your hair, depending on the mask.
Oh, okay, yeah.
I've heard stories. I've never done
Not
it.
pouring a thing of Yoplait on your head. Like a mask that has yogurt within it.
Yeah, I've heard that's a thing.
Okay, that's really cool.
Yeah,
I mean, fair enough.
like olive oil or coconut oil.
Yeah.
But yeah, don't put it on your genitals. Anybody? Nobody. Nobody be putting on the genitals.
That's a really bad idea. And any of those are, honestly, I would say pretty much that if you find any holistic kind of natural remedies that include putting items on your intimate areas, I would really caution against that and just really try keeping the area clean with water and something like a barrier cream, even like a thrush cream or Dermavine. Those are okay, but no yogurt. And that's pretty much all we have to say about vulvodynia and vaginismus. Any final thoughts? Because I had to stop you from being so like sad about it.
Well, I think for me, it challenged me to get involved with this show because I've never experienced this, and my deep core feminist would love it if we could desexualize this and stop making it about what you can't provide to your partner or to yourself, and more about the person inside who's quite clearly not having a good time. Like this, it shouldn't be the V word. It shouldn't be embarrassing, and the fact that it is means that we really need to look at ourselves as a society and go, why is this okay? Yeah. Because it's not.
And I think often we think that men often have this big bravado, and then if they can't, perform, that, it demasculates them. Is that the right word? Demasculates?
Emasculates?
Emasculates, that's what I'm thinking of. It emasculates them. But there is a sense here too that many people feel like they are not whatever gender they are meant to be in society. It strips them of their agency or feeling like a good partner or wondering what their future is going to be like.
Yeah.
So I think, there needs to be a place where we can talk about that openly, and it's not this thing that's hidden in Facebook groups. And
it's different strokes for different folks, quite literally.
One thing I did want to mention is that it is Endometriosis Awareness Month, and in Australia at the moment there's actually been a really big government push, basically the government joining forces with a number of really great endometriosis advocacy groups to put funding towards endometriosis. And one of the reasons why we didn't make this episode about endo is that one is that we wanted to get some organisations involved to come and talk to us about it, but also is that within the Spoonie community, although it is Endo Awareness Month, people are much in the Spoonie community, not in mainstream community. People are really aware of what endo is, whereas vulvodynia, vaginismus is not particularly talked about.
I'll admit my ignorance until I met Emma. So
yeah, and it's just not a thing that is talked about. So I thought that was probably, if I had to pick one of my pains to talk about, not that I have endo, but bladder stuff, pelvic stuff, it's all kind of like, people know about it, wishy-washy. I was much happy to kind of bring this to light, because I know even meeting someone in person around my age who has had the same condition as me has made me 10 times happier, because it's like you really are not alone. And because nothing against middle-aged people who have these conditions, but
it's harder to relate.
It is harder to relate. They might be at a different life stage, relationship stage, which probably is the biggest like generational gap. So it is really nice to know that there are a lot of young people out there that it's not nice to know that they have it, but it is nice to know that they have it.
Well, and I hope that this podcast brings a slice of relief to people who maybe do feel like they are alone.
Yeah, because you're definitely not.
Yeah, no.
Yeah, and things, that really bad saying that things do get better, but it takes a lot of hard work, but there are people that will believe you, and you can rehabilitate fairly well from this. Yeah. There'll be a couple of links to organisations that have info on vulvodynia and vaginismus in our episode notes. Yeah. Before we go, I'd like to thank goddammit Stacey, our beautiful artist Stacey, who did our episode artwork for today. I believe she might be making some of that artwork into a comic you can purchase on her Society 6 store.
Please purchase it.
But we'll have a link in our episode notes and in our posts. She is wonderful, and you should, to support a fellow Spoonie as well, you should definitely check out her art. And bye.
Bye.
Oh no, I meant like buy her stuff. But do you want to go?
Do you want to go?
What else should we say?
I don't know.
What about what's coming up next?
Oh, yes. What is coming up next?
It's your episode.
Okay, so next month, Georgia, will be going into Ehlers-Danlos syndrome. Looking at a bit of the history behind it, as well as what EDS is. You know, it's more than just being bendy.
Our other upcoming episodes this year are going to be on gender in pain. My favourite topic, Munchausen by internet.
I'm actually a little bit keen for that.
Yeah, I'm super keen.
Otherwise, in July, we're hoping to do working careers, Spoonie careers and businesses.
Invisible illness, chronic migraines, complex regional pain syndrome, and Crohn's and colitis. If you have any of those conditions or have any experiences or insight and you'd like to be a guest on the podcast or have a listener submission, you can email us at haveyoutriedyoga@hotmail.com, and you can find us everywhere else at haveyoutriedYogaPodcast.com. Thank you to Callum Kennedy for our theme music as always. Thank you to Cara West for our graphics. Thank you for listening.
How many listens have we had, Emma?
Oh.
Do a humble brag.
We have made it past 1,000 downloads.
Who are you people?
Thank you.
Thank you so much.
Thanks, Mom. I really appreciate it.
Mum, all of those computers, they finally came to good use.
Yeah, she's just like a speedy hacker.
Just hacking them into the matrix of the podcast.
But yeah, thank you, everybody. We
Thanks,
really
guys.
appreciate it.
So, we'll see you next month with Ehlers-Danlos syndrome. Don't worry, I'm going to put a call out asking for submissions very, very soon. Keep an eye out for that. And if you want to jump the gun, I would be entirely happy and blessed if you just emailed me when this podcast ended.
Awesome. Zebra Spoonies, unite.
Yes. Why are we called zebras? We're going to tell
find
you.
out.
Yeah.
Right, see you next time. Bye.
Bye.
Let's just